Then earlier this year, the president was reportedly exploring a commission to investigate the link between vaccines and autism. Now that led to major backlash from the medical community.
To recap, after this happened, more than 100 national organizations of doctors and scientists signed a letter to Trump saying, quote, vaccines are safe, vaccines are effective, and vaccines save lives.
Yes, but that has not stopped this from becoming a hot button issue with parents. And as ABC 10's Gabrielle Carroll found out in her investigation, California's recent law to improve the vaccination rates has a loophole that some parents and doctors are taking advantage of.
First started in a line.
Reese Baker loves going to school.
And I'm supposed to.
For her mother, Lisa Baker, sending Reese to school has meant unimaginable anxiety because Reese has been fighting leukemia.
I think it's ludicrous to think that she could lose her life to something like a cold or a communicable disease. Which these communicable diseases, not only do we have cures for them, but we have preventative vaccinations.
A law passed 2 years ago was supposed to reduce the number of parents opting out of vaccinations for their kids. But ABC 10 News Investigates has discovered parents are still finding a way to avoid vaccinating, putting babies, the elderly, people with weakened immune systems, and sick children like Reese at risk.
The purpose of SB 277 was to protect the public from preventable diseases.
The Disneyland measles
Outbreaks like this led to Senate Bill 277. The goal of the law was to prevent the spread of diseases like measles by taking away parents' ability to avoid vaccinating, what was called the personal belief exemption. Under the law, the only way kids could go to school without vaccinations was if they got a medical exemption from a doctor.
Certainly in terms of granting a medical exemption, it needs to be based on something that is factual, because this is about public health and public safety again.
We found some doctors helping parents navigate the new law and avoid vaccinations.
So you can have full support for your medical exemption request with many pages of printable materials for you and your doctor.
Fair Oaks Dr. Kelly Sutton's webinar advises parents on how to safely navigate California's vaccine mandate law.
All of the vaccine inserts all have adverse reactions listed on them, which coincide with his health issues.
Mother Denise Aguilar says she received medical exemptions for 2 of her children, thanks to Dr. Sutton.
Total was a little under $500. Now, doctors' offices are asking $500 per child.
We called around and were quoted that price by a receptionist for Dr. William Clark, an Escalon doctor who was advertising vaccine exemptions on his website next to stem cell injections and chiropractic care.
It appears to me to be taking advantage of parents' fears about their children receiving vaccines, and it also appears extraordinarily biased towards providing the exemption in ways that standard, routine, mainstream healthcare providers would not provide the exemption for the exact same conditions that are listed on the website.
Neither doctor would talk to us. In an email, Dr. Sutton wrote, vaccines cause much more injury than is formally recognized. Any mandated vaccine schedule puts children at risk. An attorney for Dr. Clark wrote that the doctor always does a thorough medical history and review before granting exemptions. For its part, the American Medical Association says it fully supports the overwhelming evidence that vaccines are among the most effective and safest interventions to both prevent individual illness and protect the health of the public. I asked Senator Pan whether he thinks some doctors might be skirting the law for personal gain.
If there are physicians who are undermining public safety and public health by unscrupulously granting medical exemptions without a basis in the actual medical condition of the patient that is grounded in evidence, that is very concerning, and it's certainly in the public interest to address that problem.
We wanted to know, how can some doctors do this? It turns out the same laws protecting patient privacy are keeping necessary information about medical exemptions out of the hands of regulators. It makes it extremely challenging for the Medical Board of California to fully investigate whether doctors are making up reasons for medical exemptions.
The medical board doesn't have the authority to get medical records without patient authorization.
So what you're telling me is right now, if you receive a tip that a doctor is giving medical exemptions that aren't medically warranted, that you have no way of accessing those medical exemptions unless the parents who might have gone to extreme lengths to obtain that exemption signs off on it?
Unless we have enough information for a subpoena.
It's a system that does little to ease the fears of parents like Lisa Baker.
Think about the rest of these kids that don't have a choice. You know, we're dependent on these other children being vaccinated. Our children's lives depend on it. We don't have a choice in their health. We're fighting for their lives.
Senator Pan says he's had early conversations with the medical board as to whether they have enough power to fully investigate doctors advertising medical exemptions. He also says he's considering introducing legislation that could hold doctors or parents financially responsible if unvaccinated patients are found to be the cause of deadly disease outbreaks, the same way that California holds folks responsible if they cause wildfires. For ABC 10 News, I'm Gabrielle Carroll.
And listen to this, the website for the doctor in Escalon has since been taken down for construction since we started reporting this story.